Hello, I'm Dr. Donna Session. I'm a reproductive endocrinologist at the Wilmington Fertility Center in Wilmington, North Carolina. So I'm here today to talk to you about the basic timeline for a fertility evaluation and some timelines for treatments of infertility. 1 in 8 couples has infertility. So this is a really common disorder, but we don't only see patients for fertility, we also see patients for fertility preservation, patients who want to delay having children, also patients that may be undergoing chemotherapy or radiation that want to preserve their fertility before that treatment. In addition, we can see patients with genetic disorders that want to lower the risk that their child will carry that genetic disorder, and also patients that may have a reason why they can't carry a pregnancy that are seeking gestational carriers. The basic infertility workup really consists of 3 tests: the semen analysis, an ultrasound, and an x-ray or some imaging to determine patency of the fallopian tubes. So in women, they have the 2 tests, the ultrasound and then the tube test. The ultrasound is usually done about day 3 of the cycle, with the first day of the cycle being the first day of the period. Not spotting, but full flow is considered day 1. And actually, that test is accurate for anywhere from day 2 to day 4 of the cycle. So an ultrasound is performed to determine the number of eggs that are growing that cycle. So the number of eggs that are growing occurs approximately 3 to 6 months prior to that cycle. And usually people are growing 5 to 10 eggs per ovary. So we're looking at that egg count. The egg count is dependent on the total pool of eggs that people have. So it's sort of how many eggs are in the bank. And that bank depends both on their maternal side and the paternal side. So if someone's family had, children in their 40s or late menopause, they tend to have more eggs. And those who might have had early menopause and kids in their 30s and stuff, they might have fewer eggs. But there are also some environmental conditions, because we do know that there are identical twins where one has many eggs and the other doesn't have any. And so there has to be something besides genetics that contributes to that. But somehow the body knows when there are fewer eggs. So the goal of the body seems to be to preserve the reproductive years. And so if people have fewer eggs, they grow fewer each month. And we do not use this test to tell people whether they can or can't get pregnant. It doesn't correlate with chance of pregnancy very well, but it does correlate with what may be the best treatment options, such as whether would IVF be feasible, would it be a good option, versus whether we would try other fertility treatments. We do use it for safety. And so if people have a lot of eggs, we're a little bit cautious about our dose of medication for safety and for the goal of really having patients have one pregnancy at a time. So the goal really is to have a singleton pregnancy. At the same time, we do some testing, some blood work, also for the number of eggs, sort of the biological clock. So one of them is the FSH hormone, follicle stimulating hormone. And that's the hormone that's released from the brain that stimulates the eggs to grow. And so if there are fewer eggs, I think of it as, the brain sort of shouting at the ovaries to make more eggs. And another test that we get is the AMH, anti-Müllerian hormone. And that is a hormone that's made by where the eggs are in the ovary. So if the AMH is higher, that indicates that there are more eggs. And if it's low, that there are fewer eggs. The next test that women have is the test to see if the tubes are open. And there are a couple different tests that can look at that. So that's usually done about day 7 to 10 after period starts. And it can be an x-ray test or it can be an ultrasound. And so the x-ray test is a speculum exam, like a pap smear, and they put a little tube in the uterus and shoot x-ray dye through the tubes. It's a quick test, about 10 minutes, and then they'll take some pictures to see if the tubes are open. The ultrasound is another option. I think the ultrasound is called the sonohystogram, and that gives us probably a better picture of the inside lining of the uterus. But we can also tell if the tubes are open using that test, but it is not as good as the x-ray test to look at the tubes. In men, the basic fertility test is the semen analysis. It's performed after about 2 to 7 days of abstinence, and it can be performed really at any time. And it gives you the sperm count, the sperm movement, what the sperm shape is. And based on that test, that will decide what future tests that we might need, such as blood work or ultrasounds or referral to urology. So after that testing is performed, we really regroup and come up with a plan for what's the best option for a treatment. So some of those options may be fertility medications and IUIs or inseminations, or it may be using assisted reproductive technologies. So if someone wants to pursue fertility medications and intrauterine insemination, that tends to be a little less time consuming than assisted reproductive technology. However, it also has a lower chance of pregnancy. Oftentimes, fertility medications and intrauterine insemination is first line for couples pursuing fertility because of the ease and the lower cost of a cycle. So typically there may be 2 ultrasounds and then a trip for the insemination. And so the ultrasounds are determining whether or not there are any cysts. They're also looking at how many oocytes are growing. They're looking at the lining of the uterus to see if it's prepared for pregnancy. And so the fertility drugs increase chance of pregnancy by usually releasing 2 to 3 oocytes rather than 1, because the most common cause someone's not getting pregnant is because the egg is abnormal. And then the insemination increases chance of pregnancy because we put the sperm into the uterus, and then has a longer lifespan in the uterus, and it gets closer to the egg. So we're just increasing the chance that the sperm meets the egg. Patients that want to pursue assisted reproductive technology, so that would be like an IVF cycle that is a little bit more time consuming. It's about 2 weeks of therapy. And so the visits are about every other day, but they're quick visits early in the morning, maybe 15 minutes for an ultrasound, a blood test, and then it doesn't disrupt the rest of the day. It usually takes about 10 days for the eggs to grow, and we're following them with the ultrasounds and blood work during that time. On average, it takes about 10 days for the eggs to grow. And then after the eggs are mature, then we're going to collect the eggs. And that's usually done about, on average, day 12 from the start of the cycle. The eggs are collected under some anesthesia with a needle that's about the size of an IV or a blood draw. So there's not a lot of risk to collecting the eggs. It takes about 10-20 minutes to collect the eggs. The eggs are inseminated the same day, and they're usually grown to about 5 days before we place the embryo in the uterus, if the patient wants to have a fresh embryo transfer. If the patient wants to do genetic testing or to freeze their embryos, then those are frozen. We usually wait about 2 weeks to get the results of the genetic test before we prepare to place the embryo into the uterus. Here at the Wilmington Fertility Center, there is a lot of personal attention that we give our patients, a lot of individual care. We also can really walk people through the process, so it's not so stressful to go through. It's a day-by-day speaking with your nurse and then walking you through to the next step. To conclude, I hope this information was helpful. If there's any other questions, feel free to reach out to us. Here at Wilmington Fertility Center, we're ready to welcome you to our family and help you along your journey to parenthood.